Hello and welcome to Policy and Politics with me, Tarun Nangia. Today, we are going to discuss the very important issue of how to push wellness tourism in India, how this industry can earn precious foreign exchange, and the need of certain standards. Now, what are those standards? World-class Ayurvedic products, when mated with world-class wellness offerings, will lead to, in a sense, a certain boost in tourism because people will be assured of a certain quality, and how that can be done, and how the Ministry of Ayush is also helping take India's name to the global scale on the issue of Ayurveda and wellness. I have a very interesting mix of panel today with me. I have with me Pradeep Multani, who's chairman of Multani Pharmaceuticals Limited, and he's the president of the Association of Manufacturers of Ayurvedic Medicines of India. He's not an unknown face. You've seen him on my show many times. He was in his earlier iteration also the chairman of the PhD Chamber of Commerce. Good to see you, Mr. Multani, and looking forward to some interesting inputs from you. I have with me Manoj Nesri. Now he brings in the ministry angle because he is advisor Ayurveda Ministry of Ayush. Good to see you, Nesri ji. And on the third end, we've got somebody who runs wellness resorts all over India. He's Siddharth Dominic. He's managing director of CGH Earth Wellness. That's where the products go into and as a human interface because they are used in his resorts. So Siddharth, good to see you on the show and looking forward to some interesting inputs. At the outset, may I request Mr. Pradeep Multani, who is the president of the Association of Manufacturers of Ayurvedic Medicines, to lay the ground of this issue before we move ahead to the panelists. Over to you, Mr. Pradeep Multani.
Good evening to everyone, and to you also, Mr. Nangia. Firstly, let me just say that the COVID pandemic further gave the message to the world that we cannot only rely on the allopathic system of medicine or the modern system of medicine. There is a great role of the traditional medical system, which is Ayurveda in India. We saw that with the huge population which we have, 140 crores plus, the number of deaths were minimal as compared to the most advanced countries. Now, this further increased the awareness that look, apart from modern, we need other things. Now, this has given a big boost to the traditional medicines and our Ayurveda, and also the active support of our Honorable Prime Minister and Ministry of Ayush, where fully realizing that India cannot have universal healthcare, that we cannot have healthcare for all the Indians unless we give a major role or an equally important role to the Ayush systems. And of course, the best thing is to let the healthy remain healthy, and preventive healthcare is the best thing possible. So the Ayurvedic medicines and our Ayurvedic wellness treatment centers, these will play a major role in India as well as abroad.
Point well taken. I'll go across to Siddharth Dominic. Now, Siddharth, you've been in the wellness space for a long time now. You run a chain of hospitality, in a sense, resorts, but now you got into this sector, which is wellness. Could you just delve into this for a bit before I go to Nesriji to get the policy angle?
Yeah, thank you, Tarun. As Pradeep was just stating that in a post-COVID era, what is playing itself is, I think, very evident. People have come to the realization that, health is something that is holistic, and you cannot just pop pills and get immunity and all of that. It comes with, and India is probably the home of all of this holistic sciences, which today I think has gained recognition. Especially all the holistic sciences have suddenly gained importance. For us in CGH Earth Wellness, we have seen a huge spike in demand from the internal Indian audience, who have suddenly realized that, yes, we need to look at our Ayurveda with a new eyes, because there is so much of, goodness and science in that, which was forgotten. And you see, in the pre-COVID era, our clientele was 80% international. but we have seen a complete transformation in the during the COVID and in the post-COVID era, which I think is a great sign. And the world is taking notice of the signs of Ayurveda.
Point well taken. You said the world is taking notice of the signs of era, and we will go to somebody who represents the government, the Ministry of Ayush. Manoj Nesri ji is a advisor, Ayurveda, Ministry of Ayush. Manoj ji, if you see the government of India under this government has made a lot of efforts to push the Ministry of Ayush. We saw renewed efforts and a lot of initiative from the government. Do you think that is also contributing in a way to this industry, and that is why we may be able to unleash the potential of the wellness sector for Indians, because this is a unique asset which we have. Ayurveda is our brand. Ayurveda is something unique to India. Could you just explore this idea for a bit?
Yes, Tarun, very rightly said that the government, the new government has very strongly focused on the indigenous sciences, the indigenous knowledge system, and one of that is Ayurveda. And for that purpose, the erstwhile Department of Ayush, it got elevated to the status of a separate ministry in the year 2014. Now, having said that, it is not only actually the elevating and creating a new ministry, then also it followed up by the various policies as well as the rules and regulations. So one of that is the National Health Policy 2017, which is a very landmark policy, I would say. And this National Health Policy 2017, it actually clearly made the roadmap for the integration of the total Ayurveda systems, Ayurveda, Yoga, and other systems in the public health healthcare delivery. So that is one aspect. The second aspect, which is very important, that the government also recognized that there is strong potential in the Ayurveda and Yoga sector in contributing to the economy of the country. And the Prime Minister actually set the goal of 5 trillion economy. And in that, one of the identified area is the Ayurveda and the Yoga, which has a very strong potential. And having identified, then actually there are two aspects into it. One is the export of the products and another is the export of services. So this export of services is a very strong focus of the government of India, along with the this export of products. And for that purpose, the government of India and the Minister of Ayush, so we have engaged very heavily with dialogue with the various international partners. There are many countries at the international level, at the same time various organizations and the academic institutes. So in last 7 years, I would say the government of India, Ministry of Ayush, we have signed the MOU with more than 25 countries in the world. At the same time, this is I'm talking about the government to government MOU. That is the MOU between the Ministry of Ayush and the Ministry of Health of the respective country. So that is one aspect which is very important. The second aspect is that the at the academic level, because for the purpose of research and for the purpose of academic training, so we have signed more than 40 different kind of MOUs. We have also established the Ayush Information Cell in various countries. At the same time, at the country level, in the domestic level, various policy issues have been taken. One of that is the Ayushman Bharat. So as the name itself indicates, so Ayushman is basically long live India. And in that now the Ayush is integrated in the Ayushman Bharat as well. And there are many health programs which are now promoted. At the same time, the government is also focusing on promoting the infrastructure in the healthcare services. In that, the champion sector of services is one of the schemes that the government of India launched, especially to encourage the private sector. And through this your channel, I would again appeal to the private entrepreneurs to actually approach to the Minister of Ayush, submit their proposals, where actually we provide the interest subsidy to the entrepreneurs in establishing the healthcare services. And at the same time, the government has also focused on the quality of the services and the quality of infrastructure. And that's why the NABH accreditation, the NABH standards for the various hospitals and the daycare centers, so they have been established. And now many hospitals and daycare centers, they are coming forward to take these NABH standards. At the same time, the benchmark standards for the Ayurveda treatment, the benchmark standard for the Panchakarma treatment. So they have been now developed and they have been published by the WHO, World Health Organization. So these are the various issues of the various areas that the government through the Ministry of Ayush has focused. So in a brief, it is the encouraging the private sector, it is encouraging the government sector, it is encouraging the infrastructure. At the same time, it is also ensuring the quality of services. So we are working on all these areas. Thank you.
Thank you. Thank you so much for sharing all these insights with us on what the ministry is doing to push Ayurveda. I'll go to Dr. Pradeep Multani. Sir, if you could explore this idea for a bit, what is the potential you see of Ayurveda and wellness married together in terms of the potential to earn foreign exchange for India? Because India, they associate with Ayurveda. All they need is trusted brands who they can trust, because these are products you use on your body yourself. So how do you marry the two, and then what is the potential? Not say having 50 resorts in India, but much more. What do you think is the potential for this?
See, in today's day and date, when we talk to our friends and colleagues who are in the hotel and other, resort businesses, we will find that I will not be able to give the precise percentage, but the majority of them have now are providing quality Ayurveda treatment there. Treatment for diseases as well as for mental stress, and also to keep the healthy people remain healthy. Now, what is happening is, from the world over, like I was mentioning previously also, that awareness is very clear. Today, our medical tourism with special focus on Ayurveda, I think sky is the limit for it. If you look at other countries, like, of course, Thailand, where they have their own traditional Thai spas and all, we know, of course, that it is very popular for it. But we have a 5,000-year science which is backing it. We have the most competent Ayurvedic physicians, doctors, and now we have also got very, very outstanding quality medicines which are here, which are being produced by our companies. The systems which the Ministry of Ayush has basically introduced is, we've got WHO GMP certified plants, which means W Health Organization, Good Manufacturing Practices certified plants at par with the best. We've got Ayush Premium Mark quality to certify quality. Then apart from that, drug testing laboratories, which are Ministry of Ayush, Ministry of Health and Family Welfare approved, and also NABL accredited. Now, apart from that, R&D facilities are there, which are approved with the DSIR. And also today, industry is also getting into medicinal plant cultivation, because 70% of the ingredients, the raw material for the Ayurvedic medicines, are herbs. And all these herbs, what I was saying was 70% of these herbs which are there are from cultivation. So increasingly good quality, outstanding quality cultivated plants are coming in. And overall, the level of our Ayurvedic products are at par with, I would say, the best in the world.
Okay, our Ayurvedic products par with. I'll go to Siddharth Dominic. Siddharth, you come from Kerala. Kerala also is a repository of a lot of herbs and a lot of natural flora and fauna. Tell me one thing, what do you see in terms of the potential of India as a destination for these kind of services of wellness married with Ayurvedic medicines, which are traditional or also which are natural and also without side effects in a sense, and also the people's receptiveness to use these centers? Secondly, also could you reflect on the inbound nature of and the potential of these services? Because we are talking of foreign people coming in. What about the local Indians also willing to spend on these kind of curative and also well-being therapies? Your insights on that?
As I was mentioning earlier, in the pre-COVID time, our experience has been, the clientele has been primarily international. And in international, I would segregate them. Europe formed a major chunk. 60% of the international was Europe. awareness of Ayurveda was very high, especially in the German-speaking world and France, Spain, and some of those countries, Switzerland. Then came the Russian-speaking world, CIS countries, where again awareness of Ayurveda and the Indian system of medicine is very high. So we had large numbers of people coming to India for treatment, for serious treatment, and as well as both. You could put them into two baskets: serious curative as well as for rejuvenative, which means detox, mental stress, insomnia, and the likes. But during COVID, when travel became restricted, we suddenly, for us, it was a discovery how India started realizing that they had difficulty in travel, and they suddenly looked towards Ayurveda as the way out. And we have seen a huge. I was getting some data from our team, and they were saying we saw a 36% spike in Indian traffic into our wellness centers. And it's purely our operation is at the highest price point, where just to give you an indicatory price, we are looking at about 35,000 to 45,000 rupees per day, inclusive of all consultation, treatments, accommodation, diet, medication, and all of that. And your minimum stay is 2 weeks. So it's a rather high ticket. But India is able to lap it up and without blinking an eye and accept that, yes, we want world class. These are people who would otherwise look at wellness centers in Switzerland or Austria or Canada or Spain and they're saying that this is on par, if not better, and offering very authentic, genuine treatments. So I think the acceptance of Ayurveda has suddenly gained a lot of credibility amongst the Indian population. Yes, all of us as Indians always knew a local Ayurvedic doctor, but we always went to the allopath for our regular issues. But today they are looking at more in a long distance as to remain healthy, to age gracefully. All of that has become part of the Indian audience too, which otherwise we saw it very much prevalent in the Western audience. And
yeah, you're saying something.
As we speak, we have, and see, this time of the year, that is December, January is high season. When it is cold in Europe, a lot of Westerners come for treatment to India. But today, as we speak, all our units have 50% of the audience is Indian, which I think is a great indication that what is the kind of demand and the willingness to pay for this kind of service.
Very interesting insight you've given, that Indians are also now willing to spend on Ayurveda and therapies, which is I'll take this issue to Manoj Nestri ji from the Ministry of Ayush. Mr. Nestri, if you could reflect on this, do you feel the government, in a sense, via its campaign that we saw hugely in the past 4 or 5 years, has contributed to this growth and interest among for Ayurveda? This has been the government's contribution in the past 4 or 5 years?
Yes, certainly I would say that, because in precisely 2018, so that time we had conducted one survey with the help of CII, and it was reported that the Ayurveda, the market size, it was in India, was $3 billion US. And now in the November 2021, the another survey we conducted with the help of RIS, which is an arm of the Ministry of External Affairs, and it was reported that now it is $18.2 billion. So from 3 to 18.2, so this is a very steep hike. And this actually show that how the actually market has increased, and this is actually only about the products. So the when I saying that the market size, it is not including the service sector. So for the service sector, we are also conducting now another survey, that what is actually the size of the service sector in India, and in that also what is the size of the foreigners, and what is the size of the domestic. So that study is already going on, but only for the product there is a steep hike, and which is very evident that it is because of the various initiatives that the Minister of Ayush took. The another factor which is very important, that Now the Ayurveda products, they are getting exported to more than 100 destinations. 100 destinations means more than 100 countries. And when I say it is the getting exported as a product, so in many countries they are going as a food supplement or the nutraceutical, and in many countries they are going as Ayurvedic medicines as such. Because if you see in the maybe some 10 years before or something, so that time the Ayurveda was recognized as a system of medicine only in a handful of countries in the Indian subcontinent, like the Bangladesh, Nepal, and the Sri Lanka, and so on and so forth. But now Ayurveda as a system of medicine is formally recognized in many countries across the continents. So it is formally recognized in Malaysia, it is formally recognized in Switzerland, it is formally recognized in Colombia, in UAE, in Bahrain, in many countries. So it is spreading very fast. And more than that, now many countries, they have in their policies, they have included Ayurveda. Say, for example, in 2020, the Brazil so included Ayurveda in the national health policy of Brazil in 2020. So likewise, the Latin American countries, they are becoming more and more interested. We have established many collaborations with the Latin American countries, even in the African countries like Tanzania and Kenya and South Africa or Ghana. So they are becoming very interested in Ayurveda. And now the latest entrant, they are the SCO countries. So it is the Uzbekistan, Kazakhstan, Tajikistan, including even the Iran. So now they are very much interested in Ayurveda, and there is a lot of actually the scope for the support the export of the products as well as the services. Now there are many requests which are coming to the Ministry of Ayush that they would like to establish these countries, they want to establish the Ayurveda healthcare centers in those countries. So since Siddharth is already here, join on this, and there could be many more who will be actually listening this. So through this, I request all these entrepreneurs to actually explore the possibility of investing in those many countries where actually they can establish the Ayurveda healthcare centers and they can provide the services. Cuba is one more country which is there. That the Republican of Dominic. So that is also, so even in the far areas like the Caribbean island, there is a lot of actually demand for Ayurveda, and thus it is actually showing that the Ayurveda is spreading very fast. There is a lot of actually recognition. Recently, the health minister of the Canada, so he had visited and he actually had shown a lot of interest, especially in the mental health area, because that is another area where actually the entire world is looking to Ayurveda as a remedy or as a solution, because the addiction and the stress, insomnia, these are the various problems which are emerging and which are there in many countries. At the same time, in countries like Japan, the elderly population, so the overall the number of elderly in Japan, it is very high, and because of that, they require the healthcare solutions, especially for the geriatric care. Now, these are the actually some specific identified areas where actually they are looking for the Ayurveda, and there is growing demand for that. And for that, the Ministry of Ayush has also started developing the skill development program. We have also now established the Ayush Export Promotion Council exclusively actually to promote the export of services and the products. So these are the various initiatives that the government of India has taken. At the same time, with the insurance sector, we have collaborated very strongly, and the IRD, they actually issued the various guidelines, and because of that, the various services of Ayurveda, so they are now covered under the insurance policy. So there are many insurance policies which are actually providing this insurance coverage to the Ayurvedic treatment, which were not being provided earlier. So likewise, there are these various initiatives on the various directions the ministry has taken. So that has actually made the base. At the same time, Siddharth, he was mentioning about the COVID. So during COVID also, the Ministry of Ayush took the various initiatives. The first and foremost important factor is that for so many years, I was not actually considered as an essential services. For the first time in the year 2020, the Ministry of Home Affairs, they issued a notification identifying that the Ayush is an or the Ayurveda is an essential services, and because of that, the Ayurveda hospitals as well as the Ayurveda manufacturing sector, so they could continue to manufacture even during the lockdown, and that has significantly helped to the sector in promoting the products as well as providing the services.
Thank you so much for giving that 360-degree insight into what has been happening from the ministry's end, and how India's reach on Ayurveda has increased to so many countries due to efforts made in the past few years. We almost out of time, so I will like to thank Dr. Pradeep Multani, Siddharth Dominic, Dr. Manoj Nesri for making time and contributing to such an important topic. Looking forward to you joining me on the same topic 2 months from now, on the same topic, to discuss what has happened, what can be done, because I think this is something that we have inherited from our ancestors, which is Ayurveda, and I think we all owe a responsibility to take it forward. Thank you and appreciate your joining us. Thank you so very much.
Thank you, Tarunji. Thank you.
Thank you very much.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.